I support criteria-led discharge.
I support criteria-led discharge.
I support criteria-led discharge.
Criteria-led discharge will support the junior doctors. If we can make sure that this is filled in full the day before, the next day the nursing staff can discharge the patient without having to bother any of the medical team.
I am a champion of the criteria-led discharge.
Criteria-led discharge will support patient flow by providing clarity with discharges and ensuring golden patients go to the discharge lounge every morning.
Criteria-led discharge facilitates patient flow.
There is a criteria-led discharge process. The patient is confirmed for criteria-led discharge at the board round or the ward round.
Criteria-led discharge can allow us to communicate better with the multidisciplinary team and make sure that we all understand what's needed to get that patient out of the acute setting and back into the community safely.
Criteria-led discharges work for us. At 6 AM our night nurses take bloods, at 8 AM I can check those bloods, and by 9 AM our patients can either be moved to the discharge lounge or can be a golden patient to get them home.
I do believe that criteria-led discharge can reduce unwarranted referrals and follow-ups for therapy staff, physiotherapists and occupational therapists. It can help us set clear discharge goals for patients, staff and family. The staff can then facilitate discharge without our input.
The doctor writes the TTOs and the discharge letter, and we order the transport, making sure that we update Swift Plus. The senior nurse will add the CLD icon to the Swift Plus board.
So it's so important that you use the criteria-led discharge stickers on the wards. For every patient that you don't discharge means another patient in the ED corridor.
Once we've identified criteria-led discharge and the doctors have completed the stickers, it can be given to your senior nursing team. We'll put it in the patient notes and ensure that their discharge goes as smoothly as possible.
Within our area we support the Safer campaign by helping with the criteria-led discharge to aim to discharge our patients smoothly to help get our elective patients in for their planned operation.
Effective patient flow means I can actually admit our planned patients for surgery.
Accurate discharge dates mean that we can plan for essential operations.
Every patient matters. We need to take their lives seriously.
I highlight patients for the criteria-led discharge.
Criteria-led discharge is part of the Safer bundle.
Let's create a social movement and embrace the Safer bundle within RCHT.
One and all, we can work together to create a social movement and embrace Safer.